السلام عليكم ورحمة الله، ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 9 in pediatric nursing. Today we are going to discuss 5 questions from question number 164 up to question number 168. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 164. The nurse is monitoring a child for bleeding after surgery for removal of a brain tumor. The nurse checks the head dressing for the presence of blood and notes a colorless drainage on the back of the dressing. Which intervention should the nurse perform immediately? The options are: number A, reinforce the dressing; number B, notify the healthcare provider; number C, document the findings and continue to monitor; number D, circle the area of drainage and continue to monitor. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number B, notify the healthcare provider. اللي اخترت الخيار رقم B نشوف rational. Colorless drainage on the dressing in a child after craniotomy indicates the presence of cerebrospinal fluid and should be reported to the healthcare provider immediately. So the correct option is option number B, notify the healthcare provider. Option number A and C and D are not the immediate nursing intervention because they do not address the need for the immediate intervention to prevent complications. Question number 165. A child undergoes surgical removal of brain tumor. During the post-operative period, the nurse notes that the child is restless and the pulse rate is elevated and the blood pressure has decreased significantly from the baseline value. The nurse suspects that the child is in shock. Which is the most appropriate nursing action? The options are: number A, place the child in a supine position; number B, notify the healthcare provider; number C, place the child in Trendelenburg position; number D, increase the flow rate of intravenous fluid. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number B, notify healthcare provider. اللي اخترنا الخيار رقم B نشوف rational. In the event of shock, the healthcare provider is notified immediately before the nurse changes the child's position or increase intravenous fluids. So the correct option is option number B, notify healthcare provider. After craniotomy, a child is never placed in supine or trundling position because it increases intracranial pressure and the risk of bleeding, and the head of the bed should be elevated. So eliminate option number A and C. Increasing intravenous fluid can cause an increase in intracranial pressure. So this option also incorrect. The correct option is option number B, notify healthcare provider. Question number 166. The mother of a 4-year-old child tells the pediatric nurse that the child's abdomen seems to be swollen. During further assessment, the mother tells the nurse that the child is eating well and that the activity level of the child is unchanged. The nurse, suspecting the possibility of Williams tumor, should avoid which during the physical assessment? The options are number A, palpating the abdomen for a mass. Number B, assessing the urine for the presence of hematuria. Number C, monitoring the temperature for the presence of fever. Number D, monitoring the blood pressure for the presence of hypertension. وقف الفيديو هنا واختار الخيار بالشوف صحيح. The correct option is option number A, palpating the abdomen for mass. This action should be avoided. ليه اخترنا الخيار رقم A؟ نشوف rational. Williams tumor is the most common intra-abdominal and kidney tumor of childhood. If Williams tumor is suspected, the tumor mass should not be palpated by the nurse. Why? Because excessive manipulation can cause seeding of the tumor and spread of the cancer cells. So the correct option is option number A, palpating the abdominal for mass. Hematuria, fever, and hypertension are clinical manifestations associated with Williams tumor. Question number 167. The nurse provides a teaching session to the nursing staff regarding osteosarcoma. Which statement by a member of the nursing staff indicates a need for information? The options are number A, the femur is the most common site of this sarcoma. Number B, the child does not experience pain at the primary tumor site. Number C, limping. If a weight-bearing limb is affected, is a clinical manifestation. Number D, the symptoms of the disease in the early stage are almost always attributed to normal growth pain. وقبل الفيديو نختار الخيار بالشوف صحيح. The correct option is option number B. The child does not experience pain at the primary tumor site. اللي اخترنا الخيار رقم B نشوف rational. Note the strategic word need for information. This word asks you to select an option that is incorrect. Osteosarcoma is the most common bone cancer in children, usually found in the metaphysis, اللي هو neck portion of the long bone, especially in the lower extremities, with most tumors occurring in the femurs. Osteosarcoma is manifested clinically by progressive, insidious, and intermittent pain at the tumor site. So the correct option is option number B. Option number A and C and D are accurate regarding osteosarcoma. Question number 168. The nurse analyzes the laboratory values of the child with leukemia who is receiving chemotherapy. The nurse notes that the platelet count is 19,500 cubic millimeter مكعب. On the basis of this laboratory result, which intervention should the nurse include in the plan of care? The options are number A, initiate bleeding precaution. Number B, monitor closely for sign of infection. Number C, monitor the temperature every 4 hours. Number D, initiate protective isolation precaution. وقف الفيديو هنا واختار الخيار بالشيء صحيح. The correct option is option number A, initiate bleeding precaution. اللي اخترنا الخيار رقم A نشوف rational. Leukemia is a malignant increase in the number of leukocytes, usually at an immature stage in the bone marrow. It affects the bone marrow, causing anemia from decreased erythrocyte and infection from neutropenia and bleeding from decreased platelet production, thrombocytopenia. If a child has platelet count less than 20,000 cubic millimeter, bleeding precaution need to be initiated. Why? Because of the increased risk of bleeding or hemorrhage. So the correct option is option number A, initiate bleeding precaution. Option number B and C and D are related to the prevention of infection, not bleeding. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.